8:15 now, and are you prepared? The World Health Organization declared the coronavirus outbreak a pandemic yesterday, and major announcements were made thereafter. From President Trump's ban on travel from Europe into the U.S., the NBA suspending their season, March Madness without fans, and Hollywood icon Tom Hanks announcing that he's tested positive for the virus. So if you haven't started, it's time to get yourself prepared with your 14-day supply kit. And joining us this morning for some tips is John Cummings from the City and County of Honolulu's Department of Emergency Management. And good morning, John. How are you doing? I guess we got to do fist bump,
elbow. Yes.
All right, it's a hard habit to break.
Yes, it is.
All right, so for people out there, do you have recommendations for people who haven't started their 14-day supply kit? What's essential?
Well, first off, I think we all need to take a little step back and take a breath,
okay.
And look at what we're looking at. Kind of need to take the panic out of the pandemic. And also, when we're talking about preparation for this event, we need to prepare with aloha for others. Right? That's a big message. And we're not looking at the aftermath of a catastrophic hurricane hit on Oahu. We're not looking at the aftermath of a tsunami event impacting us. And we have electricity now. We're going to have electricity tomorrow. We're going to have electricity through this event, right? We're not going to see severe impacts to our infrastructure and facilities that we see after a catastrophic event, right? If we have electricity, we're going to have water. And we have some of the best water in the world in our taps right now. And I'm sure Kathleen Pahinui at the Board of Water Supply will support that, 100%. So, so we're going to have a lot of these things today that we'll have through this event. But when we talk about preparedness for this, we should look at adding to our supplies, things we might need to have in place in case we get sick. We have to stay at home. We don't want to go out and spread the virus, right? In case someone at home you're caring for is sick, you want to stay home with them. So add things to their supplies. Anytime you have the flu, you're eating soups and cookies and crackers and things like that, right? Electrolyte drinks to your supply kit to replace the water. And, maybe some over-the-counter medications to help ease yourself through any kind of flu that you might be experiencing.
So you're talking about more like the crackers, the soups, the Pedialyte, and so forth to keep you hydrated, and battling this 14-day of self-quarantine, or if you're at home in isolation.
Yeah, you might be asked to stay home from work, and you don't want to go out, because again, we're looking at the social distancing measures, right? Possibly going in place. And then the same planning process you apply to your disaster planning, planning, having a kit and being informed applies. But in this case, you want to plan for the eventuality that you may have to stay home from work. You may have to stay home, your school may be canceled, right? Talk to your family about that. Prepare for the possibility that others may want to stay home and you have to support them in that regard too.
So we talk about the preparedness. What about the aftermath in terms, how do we prepare for that?
The aftermath?
After, say, moving forward. So you have your 14-day supply kit. Do you need to keep stockpiling on supplies?
Well, we're always saying that, in general, we're isolated here, large population on this island, right? We rely on a lot of things coming in from outside the state of Hawaii, on a general basis anyway, by shipping and or aircraft, right? So, anytime we talk about preparedness, we have to keep that in mind. And that's why we went to the two-week message a few years ago in regards to catastrophic events. So, we should have some supplies on hand at all times for any type of disaster. And whatever supplies you have in place will work for any disaster in general.
Now, you talk about we live in the Aloha State, and we got to show the Aloha spirit for our community, our neighbors. How do we do that without that fear of catching the virus?
There is a lot of fear out there, and the biggest way to counter fear is to understand what we're looking at. We always say, know your hazards, know your hurricanes, know your tsunamis, how they can affect you. The same thing with this virus. There's a lot of good information out there from reliable sources. We always say go to official social media sources, official government sources. Right now, for us, that's the State Department of Health and the Centers for Disease Control. And we also now have in place Aloha United 211. So if you have any questions at home, you're not sure who to talk to, call Aloha United 211 and they give you some answers.
That's a great service right there and a great recommendation. John Cummings, always a pleasure. Thank you so much for coming in, and best of luck. Can I take the Pedialyte? Or you said you always use it as well, right?
It's good. I do a lot of musical theater, and it's great for voice recovery.
All right, good to know. All right, stay with us. We'll have much more when Take Two returns.